and we're going to give out a couple of awards that we give out annually. And the first one is the James R. Andrews Award for Excellence in Baseball Sports Medicine. And that recognizes an individual who has significantly contributed to baseball sports medicine and is presented annually here at our ASMI Injuries in Baseball course. As you can see from the list of previous recipients, it's a who's who of medical professionals taking care of baseball players. And I think you'd agree that this year's recipient deserves to be added to this group. He is extremely active conducting research, focusing on throwing-related injury prevention and treatment, ACL injury prevention, screening, biomechanics of the elbow, surgical techniques for rotator cuff repair, shoulder instability. He's published his results in many of the major orthopedic and sports medicine journals, having authored more than 200 articles and 50 book chapters, not to mention having given more than 300 lectures at both national and international meetings. He's not just a researcher, he's also actively involved in taking care of baseball players, serving as a head team physician for the New York Yankees as well as the Rockland Boulders of the Independent Can-Am League. Dr. Glenn Fleissig and I have been honored to serve alongside him on Major League Baseball's Pitch Smart program and is currently president-elect of Major League Baseball Team Physicians Association. As I mentioned earlier, he shares passion for prevention of injuries and is co-founder of Baseball Health Network, which promotes the health of young throwing athletes. To give you an idea of his academic background, this year's recipient received a Bachelor of Science degree in Mechanical Engineering from Columbia University and his Doctor of Medicine from New York School of Medicine. From there, he went on to complete his orthopedic surgery residency at Columbia University, followed by a sports medicine fellowship at Curlin Jobe Orthopedic Clinic. He is currently a clinical professor of orthopedics at Columbia University, as well as attending orthopedic surgeon at New York Presbyterian Columbia University Medical Center. I'm sure you know who it is by now. As you can see, this year's recipient is more than deserving of this recognition. So without further ado, please join me in congratulating my friend and colleague, Dr. Ahmad.
I couldn't be more humbled in a moment like this. I think we would all agree that the baseball athlete, different than any other athlete, really benefits from a combined effort from physical therapists and non-operative sports medicine, surgeons, strength and conditioning. And so having a group like this together to share ideas and benefit the players we take care of and care about so much is so exciting. I have such a personal relationship with many of the people at ASMI, and when I started this 10 years ago, I felt like as a student of this game, I don't think much has changed. I still feel like I'm a student of learning shoulder and elbow problems. But along the way, without support, it wouldn't have been fun, and it wouldn't have, I think, worked for me the way that it has. So I want to share just one story. I have a bunch, but I've interacted with patients that have been in Birmingham and in New York so frequently that I've received texts from Kevin Wilk frequently about patient updates. Also, even Jeff Dugas would walk through physical therapy and tell me that a player of mine was doing well. Biomechanical data would come from Glenn Fleissig on a regular basis. And even, let's talk about Jimmy. The last patient I would say that we shared was a high school kid, operated on his right elbow, did a Tommy John, and after we were done rehabbing him, he said, "I think my left elbow needs a Tommy John." He was doing valgus stress testing on his left elbow and felt he needed it. And I said, "Well, we're not operating on your left elbow. You don't throw with it, and we're not even going to get an MRI." At his next appointment, he said, "I think I need to have my right elbow redone." He was needing another Tommy John surgery, and I said I wouldn't do it. And he came down to Birmingham, and like all athletes that Jimmy sees, he called me as soon as he saw this high school kid, and he said, "I spent an hour and a half talking him out of getting a revision Tommy John. So it's been, any success that I've had taking care of baseball players has been through my interactions with people like you in the audience and also with all the folks at ASMI. Thank you.